All right, hello everybody. Welcome to another installment of Talking Tendons podcast. My name is Associate Professor Peter Maliaris, and I have just returned from the International Tendinopathy Scientific Symposium, which was an absolutely fantastic 3 days of listening to other tendon researchers, talking to some really great people about what's going on in tendon research, and it was just a very enjoyable day. Very enjoyable 3 days in Groningen. So congratulations to the organisers there. What I wanted to talk about today in our 10-minute Talking Tendons podcast is really just to go over some of the more recent evidence around psychological factors in tendinopathy. There has been quite a bit, and a lot of it was presented and talked about at the conference, so it's a really interesting and topical area. And I would like to talk about some of the recent ones that have been published. So I want to start with one that was published in the British Journal of Sports Medicine's a systematic review, and it was published back in 2016. The lead author is Adrian Mellows, and Adrian was at the conference and presented some of his work, but not this study in particular. Others on the paper are James Debenham, Tom Walker, and Chris Littlewood. So this was a systematic review, and what they focused on was really trying to synthesize all the evidence that links psychological factors and tendinopathy. So they looked at things like anxiety, depression, kinesiophobia, catastrophizing, and whether people with tendinopathy present with these types of psychological factors. Now, you can look at this in many ways. You can look and see if there's an association. So, is there a cross-sectional association between these factors and tendinopathy? Are these factors predictive of the onset of tendinopathy symptoms? So there you're looking more at risk factors. And once you've got tendinopathy, are these factors predictive of outcome? So do they mean that you're going to be less likely or more likely to get better? So that's the different ways you can look at it. And with this study, they did look at compiling evidence that looked at various relationships, I guess you could say. So let's look at the aim is always useful to look at. So their purpose was to determine if psychological variables are associated with tendinopathy and whether any such variables may be associated with pain and disability outcomes in conservative management. So it seems like based on that, they were looking at whether these factors predicted outcome and also whether these factors were associated with people who had the conditions. So I'm going to give you a very, very gross summary of what they found in this paper, and I would definitely recommend reading it. So now they found that there was very little evidence that factors like anxiety and depression are associated with tendinopathy. So, for example, conflicting evidence for lateral elbow tendinopathy, limited evidence that it's not associated with that these factors, anxiety and depression, were not associated with patellar tendinopathy, and moderate evidence that distress was not associated with rotator cuff tendinopathy. When you look at factors like catastrophizing and kinesiophobia, it was a very different story. So here, they generally found that there were some links. So there was moderate evidence that catastrophizing and distress, actually, in this instance, was associated with lateral elbow tendinopathy. Moderate evidence that kinesiophobia and catastrophizing were linked to rotator cuff tendinopathy. And also there was some evidence linking kinesiophobia with suboptimal outcomes in tendinopathy. So there seemed to be more of a relationship when you're looking at the psychological constructs like catastrophizing and kinesiophobia. And when I was presenting this exact um, evidence in a invited um, session that I had at the tendinopathy symposium. Adrian happened to be in the audience, and I confirmed with him, is that interpretation correct? And he said yes. So you can take it from pretty good authority, i.e., from the first author's mouth, that this is in effect a summary of what they found. So that's interesting. I'm going to now move on to another study. This was published in this year. It was published in 2018. And the lead author here is Melanie Plinsinger, and she's part of the group led by Bill Vicentino at the University of Queensland. So this is research which was also, I believe in part at least, presented at the International Tendinopathy Symposium. Melanie gave a really great presentation and summary of a lot of this data. So in one of the first sessions, I believe on the second day, so I'm going to just tell you about their paper. Basically, the title is Psychological Factors, Not Strength Deficits, are associated with severity of gluteal tendinopathy, and they've undertaken a cross-sectional study. Now, the real strength of this study is that they recruited 204 patients with gluteal tendinopathy, which is pretty amazing feat, because it's not easy to find these patients, and to find 200 of them is really going to take a lot of work. Not only that, they've gone through a full battery of psychological, quality of life, even strength testing, and weight circumference and hip circumference, and hip abductor torque ratios, physical activity. I mean, looking at that list of outcomes, I can imagine that would have taken hours to measure these people in the lab. So it's it's a large study, and I'm going to focus on the psychological. Well, we'll focus on some of the psychological and some of the other outcomes. But what I want to alert your attention to, again, please read the paper, because this is just giving you a very, very brief overview of a snippet of the paper. I'd like you to go back and have a read of the methods, but there's a figure which is figure 1, and basically they present the standardized mean differences, and they have compared here people who have severe tendinopathy symptoms based on the visa to people who have mild symptoms, and they've also compared people who have moderate symptoms to people who have mild symptoms. And what they find is pretty interesting. They show that people with severe symptoms are far more likely to be different from the mild group, and they are different in their pain, as you would imagine, but also they have far higher depression and catastrophizing, and they also are heavier and have a higher waist girth, and they also have less physical activity and have lower quality of life. So there are some interesting relationships there, and what we don't get out of this, because it's a cross-sectional study, is what is the temporal relationship between these factors. So is it that these people are very, very fearful and catastrophize their pain, therefore develop severe tendinopathy, or does it go the other way, that they develop severe tendinopathy, they become they really start to freak out and catastrophize and reduce their physical activity? So it's difficult to say the relationship in which way those factors go. And I just briefly want to finish off with one of my students' studies, and this was also presented at ISTS, and this was, so my student is Jack Mest, and he's building up towards some higher degree studies, and the other co-authors, so there's 2 other co-authors, and it's Brett Vaughan from Melbourne University, and Jane Mulcahy, and I'm sorry, Jane, I've never said your surname before, even though we work together. Um, yeah, I don't think I said it correctly that time, but forgive me. And so that was our team. So me, Jack, Brett, and Jane, and basically it was just a cross-sectional study again of 91 participants who presented to the clinic that I work at with lower limb tendinopathy, and we gave them a battery of psychosocial measures like the hospital anxiety and depression scale, the Tampa scale, the kinesiophobia life orientation test. And I'm not going to go through the details. It's not published as yet, but we presented an abstract at the Tendinopathy Symposium. And what we basically concluded here was that the biggest factor was kinesiophobia. So if we look at, there was a graph which was something that I might post along with this podcast, but the graph clearly shows that if you categorize people on the Tampa as kinesiophobic or not, most patients with lower limb tendinopathy, a majority, more than 50% and up to almost 80% for some tendinopathies, can be classified as kinesiophobic, which is really indicating that this is a factor that we really must look at and try to address with this patient group. So they were the three studies that I wanted to focus on. So our one is not published, but definitely go and check out. So Plinsinger et al. 2018, which is published in the, just looking for the journal here, sorry, in the, I can't find the journal, I'm sorry about that. I will make sure that I link that in the notes that go with this podcast, so you can look up their paper. And then the British Journal of Sports Medicine by Adrian Mellows, the systematic review, which was published a couple of years ago. Okay, so they're the two studies to look into. So really the message from this podcast is make sure that you're looking at psychosocial factors. Even if they are following the onset or after the onset, it's still something that we do need to address with this patient group. Fantastic. Thank you very much for listening, and I'll catch you next time.